Hey, how are you today? It's Coach Northern with IVictorHealthcare.com. And today we're going to be talking to you about our Medicare Part D prescription drug plan. We're going to tell you how to choose a prescription drug plan. We're going to go over a calendar, kind of giving you an idea of when you should enroll. We're going to talk about the drugs that are not covered in prescription drug Part D, and we're also going to talk about the tiers of those drugs in Part D prescription drug plans. And then finally, we're going to talk about how we can help you with your enrollment, and also how your local Walgreens or local pharmacy can help you as well. Let's start with when to enroll. When are you going to enroll? What is the calendar date? Well, when you become eligible for Part A and Part B, 3 months before your 65th birthday and 3 months after your 65th birthday, you have the opportunity to enroll in Original Medicare, Part A and Part B. Of course, you know, Part A covers your hospital's visits, and Part B covers your doctor's visits or medical services. And then, of course, you have Medicare Part D, which covers your prescription drugs. This is very important because whether or not you take prescription drugs or not, once you enroll in Original Medicare, you have to have prescription drug coverage. Medicare calls that credible prescription drug coverage. This is a part that I like to repeat to people because a lot of people ask the question, hey, Coach Northern, if I'm not taking prescription drugs, why do I have to enroll in a prescription drug plan? That's just extra money. Well, it's the rules. The thing of it is if you do not enroll in a prescription drug plan at the time that you become eligible for Medicare Part A and Part B, you could run the risk and have the potential for being charged a late fee. They call that a late enrollment penalty. Once you enroll in Original Medicare, after you enroll and you have your effective date, you have 63 days to enroll in a prescription drug plan. Anytime you go 63 days without a prescription drug plan, you're running the chance of having a late enrollment penalty. Now, there is an option that you don't have to take prescription drug coverage. And obviously, a lot of us these days, we work past 65. So we still have our employer coverage. We have employee health coverage through the people that we work for. Now, once you become eligible for Medicare, Part A and Part B, talk to your benefits administrator to find out how they coordinate those benefits. But remember this, even if they coordinate those benefits, they have to have a credible prescription drug plan. I'm going to keep that part short and simple for you. That means that your employer's prescription drug plan or your employer's coverage has to be better than or equal to Medicare prescription drug coverage. Okay? How about that? And if they have credible prescription drug coverage, then you can extend the time that it takes to enroll in Medicare Part D. That means you don't have to take it right away. You only have to take it when you decide to retire. The next section is which plan should I choose? How do I choose? You're asking yourself, Coach Northern, which one do I choose? Well, this can be confusing, but don't worry about it. We can make it easy for you. You can contact us at IVictor Healthcare and Services at 314-565-9674, and I'll do it for you at no cost. Okay? I'll enter in all your meds on my formulary, and I'll look it up and I'll send you the answers to which plan you should sign up for. You can do it that way. Or you can choose on your own. How can you choose? Well, here's what you need to know. You need to know that there are 3 basic ways that you can sign up for a prescription drug plan. The first way is a standalone prescription drug plan. That means that only the prescription drug plan and Original Medicare is what you'll have at the time. Or you can sign up for a Medicare Advantage prescription drug plan, which means that you'll have Part A and Part B in one plan, or all in one plan, and your prescription drug coverage. The third way that you can sign up is if you go with the Medicare supplement with original Medicare and also a standalone prescription drug plan. We're talking about how do you choose. Well, I'm going to make it real simple for you guys. The way you choose is based on one particular principle. Are all of your prescription drugs covered? In most of these plans, some prescription drugs aren't covered. So when you're choosing a plan for your Medicare Part D plan, make sure that all of your drugs are covered. That's why you can call us and we can go over the formulary and see if your drugs are covered by any one of the plans or any one of the private insurance companies. The formulary, that's what they call the drug list for each private insurance company. That's where you can find out whether or not your prescription drugs are covered. In the formulary, each drug has a tier or a level, if you will. It goes from tier 1, tier 2, tier 3, tier 4, and tier 5. Okay? Simply put, tier 1 is preferred generic drugs. Preferred generic drugs. It can usually cost you anywhere from $0 to $5 as a copay, depending on the drug or the prescription drug plan from the private insurance. Tier 2 is your generic drugs. It can range anywhere from $5 to $50, depending on the drugs or the private insurance company. Tier 3, these are preferred brand names. It can run you anywhere from $40 to $100. Again, it depends on the drug and it also depends on the private insurance company. Tier 4, non-preferred prescription drug, brand name prescription drugs, that'll run you anywhere from 32% to 35% co-insurance, depending on the drug and depending on the private insurance company. And finally, tier 5, those are what we call a specialty tier. That can run anywhere from 25% and up when it comes to co-insurance. In some plans, prescription drugs aren't covered. This is something you need to look out for because drugs like cosmetics, weight loss, ED or erectile dysfunctional drugs or fertility drugs, and then sometimes your over-the-counter drugs like aspirin and Advil and things like that. Also, what you need to look out for is that the monthly cost is going to range or be different for each private insurance company. Private insurer 1 might charge one thing. Private insurer 2 might charge another cost. And private insurer 3 might charge you some other monthly premium. So you have to be aware that sometimes your prescription drug plan can have its own singular monthly premium. In addition to the monthly premium, you're also going to have to worry about deductibles, co-pays, and don't forget co-insurance. We kind of talked about that earlier when we were talking about which tier each drug is in. For some of you folks, depending on your income, you're going to qualify for financial assistance for your prescription drug plan. This is what we call extra help. It's through Medicare, and extra help is going to pay for your premiums, might pay your co-pays, or even your deductible. You have to call, or you can call us, and we can look right away and take a few seconds for us to figure out what your level is for financial assistance. We can do that right here at IVictor Healthcare and Services. If for some reason or another you don't get to call us, call Social Security and ask them if you qualify for extra help. That's 800-772-1213. Also here at IVictor Healthcare and Services, we can help you find Medicare savings plans. We can also help you with internal plan rewards and incentive programs. So remember that. There's also what we call 90-day mail pharmacy discounts that we can help you with. So call us or email us. Understand preferred pharmacies is also important. Sometimes private insurance companies only work with certain local pharmacies. So that's another thing that you need to be aware of when you're trying to figure out how you can save money on your prescription drug plan. So, a quick recap. Let's keep it simple, folks. Make sure you enroll on time. Remember, 63 days without prescription drug coverage after you already enrolled in original Medicare, there could be a late penalty. Also, pick a plan. But when you're picking that plan, make sure that plan has your drugs on their formulary. And there are alternatives to your drugs, but check with your doctor or your local pharmacist to find out what those drugs are, and then give us a call and we'll look them up on each formulary to find out whether your drugs are covered or not. Contact us for help. We have all the answers, and you have nothing to fear. And remember, there's only one victor, and that's you. Have a great day. Here's my number where you can contact me. Thank you for looking, and thank you for listening. Like our video, and give us any comments you might have also. Have a great day. Prescription drug coverage. And you can find that out through whoever your benefits administrator is, or the person that's in charge of your health plan at your job.